The study was kind of born out of the idea that since trabeculectomies have benefited from anti-metabolites in order to control the scarring response, that glaucoma drainage implants would also benefit from some sort of ability to prevent scarring. In previous clinical trials, the same sort of anti-metabolites that we use, like 5-fluorouracil or mitomycin C in trabeculectomies, haven't shown any benefit with glaucoma drainage implants. We had some anecdotal evidence that anti-vascular endothelial growth factor, anti-VEGF injections that people were getting for a totally separate reason, it seemed that those people, when they were getting glaucoma drainage implants, were actually benefiting, and those implants were doing better. And so we wanted to do a sort of larger scale retrospective cohort study in order to figure out if maybe there was some sort of benefit for people who were actually getting these injections in a separate part of their eye. The patient populations included in the study were people who had a diagnosis of dry AMD who had not been getting intravitreal anti-VEGF injections. The other population included in the study was patients who had what we call wet AMD, and those people were getting anti-VEGF injections specifically for their AMD, not for neovascular glaucoma. And so what we found is that patients who are getting these anti-VEGF injections for their totally unrelated condition, as far as we could tell, to their glaucoma, tended to have higher success rates and lower failure rates. Interestingly, at the estimated 5-year survival rate, the survival rate for eyes that had been getting these anti-VEGF injections was 100%, whereas the dry AMD arm that was not getting anti-VEGF injections had an estimated 5-year survival rate of only 72%. So it seems like there's a pretty big benefit for doing these treatments.